Hello, my name is Andrea Richards, and I am on my second year at the University of New England working on my Master's of Public Health. I graduated from the University of Maine of Farmington back in 2004 with my Bachelor's of Science in Community Health Education. I live in a small rural town of Franklin County called Jay, and I live with my husband and my two boys and my two yellow labs. Currently, I'm employed at the Healthy Community Coalition, which is a nonprofit here in Franklin County, where we are the preventative arm of our local hospital, Franklin Memorial Hospital. I work on two different grants. The first grant that I work on is the Let's Go 5210 grant, where we are promoting healthy living to children through nutrition and physical activity promotion. The second grant that I work on is a grant that we received through the Maine Health Access Foundation for healthy communities, and our focus is to help people living in poverty to increase their health, specifically around obesity, but also making sure that we're educating the community on what poverty actually looks like, especially here in rural Maine, and to work with the school systems on assisting children and families living in poverty through system changes. A big part of our program is to create connections to other community members, who we call navigators, to work with people living in poverty, to help them access the resources that they need, as well as to help build their strengths and build their network so that they can be better set up to succeed. I don't have any direct experience with conducting a community health needs assessment. When I first started with the Healthy Community Coalition almost 2 years ago, I came in at a time where they were sharing the results of their most recent community health needs assessment, and that was a good experience for me, but really the only experience that I've had. That report identified the 5 top health issues in Franklin County as obesity, drugs and alcohol, physical activity and nutrition, cardiovascular diseases, and mental health. And the top 5 factors that were affecting health the greatest that were identified in this health needs assessment was poverty, transportation, employment, food security, and access to mental and behavioral health services. And specifically because of my work, poverty being identified has been really important, and there's been a lot of traction within our community to start working on poverty and looking at it as an indicator, as a health issue in our community that can be worked on. Initially, a lot of people did not believe that poverty is something that can be changed, but we believe that through some of the steps that we're taking, and then a lot of work and help through the community and the other great resources that we have, that we can make changes. So because of the things that I work on, I have decided that my 2 possible communities will be looking at the health needs of people who are utilizing the emergency department as their primary care at our local hospital in Franklin County. We have a lot of people who do not have primary care physicians and are frequent flyers to the emergency department here. And the other group that I potentially would like to look at are the health needs of children who are obese, and those children who are in our Franklin Health Network offices, so our pediatric and our family practices would be my community. So I am looking forward to meeting all of my classmates and learning more around conducting a community health needs assessment. Thank you.